I recently met with Dr. Susanna Naggie, our Vice Dean for Clinical and Translational Research and Director of the Duke Clinical and Translational Science Institute, to talk about our work underway to strengthen community partnerships across Durham and the region. So, Susanna, thanks for joining me today and to talk about the Clinical and Translational Science Institute, CTSI. So start out, the big picture. What does CTSI do for our researchers and our faculty?
The CTSI, as you said, is an institute, and we have a large number of areas of focus and resources that are open to faculty. I would maybe put them in a couple of pillars, if you will: workforce development, community engagement. We actually have a very large pilot grant program. Mm-hmm. There is an area that we really call resources and services, and that focuses on innovations in research, ways that we can support faculty to truly innovate. And then data science and AI. So it's pretty broad. And I think some of these are unique. Community engagement, I think, is really a defining feature for the CTSI. But we really do offer a large number of services across a pretty broad spectrum.
So thanks for mentioning community engagement. We are in downtown Durham. And community partnership is one of the 4 missions of the School of Medicine. Mm-hmm. So talk a little bit about how CTSI facilitates that mission.
Yeah. I think that started because of the grant, the CTSA, which the A stands for award, that has funded the CTSI in part since 2006. And that is funded by the NIH. And the focus from the NIH was on understanding the importance of community engagement and community partnership in advancing science. And what we mean by that is we know that there are many medical discoveries that are highly efficacious, meaning they have been efficacious in studies, but they are not effective because they have not made it to the right population. And again, because the NIH is focused on this, is really critical in translational science, it has become a true strength and pillar for us in the CTSI.
So, Susanna, Durham is our home, and the health system takes care of many people that live in Durham, but we can't talk about the health of Durham unless we talk about how we partner with our community across all missions. So talk a little bit about how we facilitate all of our missions by good, strong community partnership.
Yeah, this is so absolutely critical. I think, again, as I mentioned, for the CTSI, clinical engagement and research is something that we think a lot about. And I think we have a pretty large footprint across the School of Medicine in this space. As I mentioned, this really does get to the idea of we are a medical institution, we are a health system, and we are a research institution, an educational institution. And if we do not do that in a way that engages the community, then the impact is lost. So in research, that has to do with, as I mentioned, the translation of that research. If the community members, if the patients in Durham that we take care of don't understand how we got to that intervention or why and how that's important to them, it is much less likely that they'll be willing to take it. Right. When it comes to health, again, we talk about this a lot. We want to make sure that the things that we're discovering in science at Duke are translated directly into the care of the patients that we take care of. But that doesn't happen if the community hasn't helped us think about how that aligns with their priorities and think about the ways that we message this to our community so that they actually trust what we're saying and are willing to consider then following through on that on the clinical side. And the education piece is the final piece. I think it's going to be really critical for us to think about how we train the next generation, recognizing the importance that community plays and people who live in the community and engage in the community and leaders in the community in education, research, and clinical care.
Yeah, also important. And I'm always struck by the fact that we take care of 80 to 85% of the population in Durham. It is our community.
Yeah.
And that partnership is so critical to the health of our community. But we often talk about one aspect of partnership is meeting our community where they are. What does that mean to you when you think about some of the work that you do?
Yeah, that is really, there's so many ways to answer that question and it's a big one, right? Yeah. There are textbooks written about this, and it is about meeting people where they are. And I would say that's how we want to think about patients and participants is we shouldn't ask them to come to us. We should be thinking about how we go to them. But I think the other big thing in community engagement and community partnership is to recognize that the community has an expertise. They have a knowledge that we do not have.
Yeah.
So it's coming to the table in a way that is totally respectful of what the community has to bring to us in terms of their experience, what they understand, what they know, and then developing it together. It's co-development, it's co-leadership, and it's true mutual respect.
So we've talked a lot about community partnership and engagement, but sometimes really giving a tangible example is much better than talking at high level. So what's a really tangible example of the work that we do?
A really nice one that's been long-standing and kind of gets to the concept of all the work in between and building trust is the Amy Zion Heal initiative. You know, this is work that's been done and funded through the CTSI. So again, the grant to ensure that community voice is part of the research that we do. So this is actually a group of a number of representatives from a number of faith-based organizations across the state of North Carolina. And they will work directly with our investigators and research teams to co-design protocols, to ensure that the way that recruitment is happening is really centric to the groups in the community that the study is relevant to. It's focused on education of the community and working in events with these various churches to educate folks about the importance of research. Like, why would you participate in research? How can participating in research help your community, right? And they have engaged in over 300 different community organizational health fairs and events. They have actually helped co-develop over 60 different protocols for research. And it's a very long-standing relationship. And I think it just really gets to the ways that you can ensure that this is deep and meaningful in terms of the engagement that happens.
Trust.
And there is the trust, which I just cannot emphasize enough.
Right. Yeah, that's really terrific. You're obviously passionate about this, and you're a longtime Dookie.
Yes.
What is it that makes you most proud of the work that you do at Duke?
For me at Duke, I've been here a long time. I stay at Duke because of the people. I know it sounds cliche. It's 100% true.
Yeah.
The people at Duke are phenomenal. I have great confidence in all of our team members and the passion that they have for advancing science and health, and particularly the health of our Durham community.
Well, the work that you do and your team does every day inspires me. Thank you so much for everything that you do.
Well, thanks for having us.